what are basically the fertility issues regarding which the couple should turn for medical advice?
So now this again is going to be a podcast on its own if we go for it.
Okay.
Okay, so generally when I look at fertility issues, we divide it into 4 parts.
Okay.
30% is where the woman's issues are.
Okay.
30% is where the male issues are. 30% dono mein issues hai. And in 10% there's no obvious cause of why there's no fertility. So it's called unexplained infertility. In fact, that 10% is the most difficult to treat.
Right.
In the others, when you know the cause, you can treat it. So अगर हम males को देखने जाए, we are mainly concerned with the 3 parameters which I spoke about the sperms. कि count कितना है? If it's less than 15 million, 15 million, please go visit your gynecologist.
Okay.
If the motility, मतलब आगे बढ़ने की ताकत, if it's less than 40%, meet your gynecologist. And if the normal sperms is less than 4%, once again go meet your gynecologist. Now, when I turn over to the women's side,
and all this can be found out by a test.
A semen sperm test.
Sperm test.
Matlab, you go give your sample in any lab, any of these labs which are available, they do your semen analysis, you'll get the report within 2 hours. ऐसा नहीं है कि 4-5 दिन रुकना पड़ता है.
Right.
So that way you get the reports immediately. In the women, I spoke about the tests which need to be done, but one other issue that can be there is now if you just look at the symptoms, irregular periods is something that you should go and visit your gynecologist. That can be usually a sign of PCOS, most common, but there are other factors as well. But I think that can be diagnosed only after investigations.
Okay.
Dusra, if you're having severe pain during your periods or you're having pain while you're having sex with your partner, these can be pointing towards signs of endometriosis. Endometriosis is a condition where when you get your periods, the period blood is coming out, but it's also going through your tubes into the pelvis. And this can cause pain and all in the woman. Then there is something called as adenomyosis.
Okay.
There's a swelling in your uterus because of this endometriosis. So that can be another problem. Then you have fibroids, which I'm pretty sure everyone's aware of. पर वो कभी पता नहीं चलेगा जब तक आप गायनोकोलॉजिस्ट के पास जाते नहीं है.
जी.
And then there is something known as your blocked fallopian tubes. जो नली रहती है, जो ट्यूब, जो ओवरी और यूट्रस को कनेक्ट करते हैं, वो अगर ब्लॉक्ड रही तो then pregnancy के chances कम रहते हैं. तो these are just some of the common issues. Tuberculosis, that's another major issue that's rampant in our country. So if you are a known case of that and अगर आप प्रेगनेंसी के लिए ट्राई कर रहे थे और नहीं होता, so that's when you should visit a gynecologist as well. Very simple thing I'm saying, but if you're not able to have sex with each other, we have sometimes couples who come that we've tried to have sex but we're not able to have penetrative sex. Those couples also need to go to their gynecologist and speak to them, because we need to examine the partners and see what is the reason for the inability to have sex as well. That's something that also needs to be examined at.
These are the general issues.
Yes.
And I think it's like आज आपने बहुत अच्छे से बड़े सिंपल तरीके से वो चीजें बताई हैं जो है, लोगों को अवेयरनेस है, बट आई थिंक उन्होंने कभी इन चीजों को इतनी इम्पोर्टेंस नहीं दी टू अंडरस्टैंड कि शायद ये वजह है उनके conception ना होने की, right. And there is help at hand, which is the most heartening thing in today's time, which can, with simple techniques, simple lifestyle changes, most of this can be taken care of according to you, right?
Yeah.
Right, perfect. So talking about these fertility issues, Dr. Ron, even age plays an important role in both men and women, or are these issues also age related?
So now let me go about this in a different way. They always say कि men का reproductive age goes on forever. Like you've seen men who are 60, 70 also have babies. Right. With the woman, it's slightly different. Age is the most important factor for women. तो जैसे age बढ़ते जाता है, the chances of pregnancy keep reducing in a woman. So that's why I've been promoting about egg freezing for the longest time, because now women are a lot more empowered.
Right.
They are focusing on their studies, they're focusing on their careers. Even if sometimes they've not found the right partner, they find a partner late. So I always recommend them कि if you can freeze your eggs, go ahead and freeze them. Because क्या होता है जब हम eggs freeze करते हैं, suppose I've frozen your eggs at 28, and at 36 you decide to get pregnant, you can get pregnant naturally, but in case अगर आपको IVF की तरफ जाना पड़े at 36, आपके अंडे जो 28 साल के हैं वो 28 साल के ही रहते हैं अगर even though you're 36. So we can use those eggs, and the eggs I use at which you frozen earlier will give you a better success rate than the eggs I use at 36. So that's why age becomes one very important factor in a woman's life when it comes to pregnancy. Now there are recent papers which are coming up, research studies ki even the people with men's age which is higher is showing some problems in the kids. They're showing ki there's a higher risk of autism. They are showing that the lifespan of those babies is reducing. The chance of genetic abnormalities are higher. So there, जैसे हम लोग बोलते हैं, there is andropause also coming into play as a role. Menopause जो बोलते हैं कि for women's periods to get a andropause we say is when the man's testosterone level starts dropping. So it's a new concept which has been coming, but now research papers are showing that if you're an older father, the child can have these problems. Issues.
So when you specified like 28, 36 का जो आपने example दिया, आपको कहने का मतलब है the quality of the egg goes down?
So there are two things that happen. Quantity of eggs are also going down, plus the quality of eggs is also going down. See, आप menopause क्यों hit करते हो? क्योंकि आपके ovaries में जो eggs है वो खत्म होते हैं.
Right.
See, when a mother is pregnant, if she has a female child, when that embryo तैयार होता है माँ के अंदर at 6 weeks or 7 weeks, there are 7 million eggs. Okay? But by the time she's born in 9 months, it's 1 million. By the time she hits puberty, she has barely 1 lakh eggs. And those 1 lakh eggs are used over the next 30 years. जिसमें से हर महीना सिर्फ एक अंडा छूट जाता है, बाकी के 10-20 जो ग्रो हो रहे हैं वो वेस्ट होते हैं. तो हर महीने around 20 eggs are being wasted, only one's being used. So that's why we say that the aging in a woman starts when the mother is pregnant.
Got it. So आपने जैसे अभी ये बात करी कि अभी मेल में भी ये चीज़ है कि it can lead to autism and other thing.